First at 5, a major announcement today from the state and its ongoing efforts to protect kids. Maine's Office of Child and Family Services is joining the National Partnership for Child Safety. Maine's Department of Health and Human Services says the collaborative promotes safety science, a model to improve child welfare practices. That means participating in the partnership's database as well as a review and prevention case reporting system. According to DHHS, they're doing this so Maine can work to identify trends and major risk factors. Now, despite changes that are being made and money being allocated, there are many people who are still very critical of the state's child welfare system. News Center Maine's Caroline LaCour reports from Augusta.
Feelings of disappointment just scratched the surface for dozens rallying at the State House here Tuesday with a mission to prevent child abuse. But despite shortcomings, they say giving up hope is not an option.
It's real easy to do nothing, and it takes a big effort to do something. But when that effort is presented to you, and when solutions are presented, I wish the government would react.
On an overcast day, advocates and members of the nonprofit Walk a Mile in Their Shoes expressed their concerns and called for change within Maine's child welfare systems in honor of the several children lost to abuse.
We had people tell stories about their experiences, and that's what's most important. I think the public can see and feel why we're working and doing what we're doing when they hear stories like this.
Founder and former state senator Bill Diamond says the past couple of months have brought some progress with a change in leadership at the Office of Child and Family Services, as well as new reports that address the kinds of change needed.
I think the Government Oversight Committee did so much work and so much came out of that for suggestions that I'm really hoping that they will pick things back up.
But child advocates like Melanie Blair say they're now waiting on state leaders to take action and apply those suggestions.
This is certainly a positive and dramatic change.
One of which is to separate OCFS from the Department of Health and Human Services, something that lawmakers failed to pass this session.
It allows them to just not even talk about it, and at the end of the session, adjournment, that dies. That's not a way to address something this important.
Moving forward, advocates are calling for more transparency within the office to show that promises are being kept.
We don't even know if it's broken because we don't know what the system looks like.
Coming all the way from Calais to speak as superintendent of schools, Mary Ann Spearin. One side effect of a lack of transparency, she says, is the uneasiness teachers are feeling when reporting possible abuse, not knowing if those reports will actually help children.
Our staff feel like they're being abandoned. We feel like we're sending our kids home to the unknown.
Advocates say this isn't about pointing fingers, but rather working together towards a solution.
All of this points us in the direction that this thing is bigger than even what we've learned it to be.
Advocates are calling on lawmakers to keep their concerns in mind when they return here at the State House for the next legislative session. In Augusta, Caroline LaCour, News Center Maine.
A spokesperson from the Department of Health and Human Services tells News Center Maine that other significant investments are also being directed toward child welfare systems, like establishing new onboard training positions for each district and increasing pay for its staff.